My name is Jose Osorio. I'm a director of cardiac electrophysiology for HCA Florida. Your heart has 4 chambers. The top chamber of the heart we call the atria, and the lower chamber is the ventricle. So under normal conditions, an electrical system tells your heart, which is a muscle, when it's time to contract. The sinus node, which is the pacemaker of your heart, will tell the top chamber, the atria, to contract first, and then the lower chamber, the ventricle, will contract next. So that's the normal operation of the heart. When you have atrial fibrillation, the top chamber, the atria, is no longer contracting in a normal and organized fashion, but rather just quivering very fast. It's important that you understand that, because then you will understand the implications, what atrial fibrillation could cause. If the top chamber is not contracting, your heart can go very fast and blood is not going to be pumped as much, so that's why you have symptoms such as shortness of breath, fatigue, dizziness. But also, because the top chamber is not contracting, blood can pool in a little area that we call the left atrial appendage, and when blood doesn't move, a clot can form. If that clot dislodges and goes to your brain, you may have a stroke. So understanding what atrial fibrillation is will make you understand what implications it may have in your overall quality of life and your risk of stroke. It's important for you to understand what are the types of atrial fibrillation that we have. Atrial fibrillation can be paroxysmal. What that means is that the episodes come and go. They may last minutes or a few hours, but you will go back into normal rhythm on your own. For patients that have paroxysmal atrial fibrillation, while in atrial fibrillation, they will have symptoms such as palpitations, fatigue, shortness of breath. But when they go back into normal rhythm, they feel normal again. Sometimes they may feel tired for a few hours, but typically they go back to their normal lives. Patients may have episodes once a year or as frequent as multiple times a day. Next, you have patients with persistent atrial fibrillation. For patients with persistent atrial fibrillation, you go into the rhythm and you stay out of rhythm. So for those patients, the only way they will get back into normal rhythm is either with a medication or with an intervention, maybe a cardioversion or an ablation. The next stage of atrial fibrillation is long-standing persistent. That means one has been in continuous atrial fibrillation for longer than 1 year. And the implication here is that when you are in continuous AF for that long, the chances that we can successfully get you back into normal rhythm are much lower. Finally, if you stay in atrial fibrillation for many years, we call it permanent atrial fibrillation, because at that point, we're no longer able to restore the normal rhythm of your heart.